Thank you. Well, good afternoon. I'm just delighted, and you can tell by the roster of speakers, to be included in what I think has been the culmination of a years-long effort in bringing the MEG to Atkinson. For me, when I actually think as a neurosurgeon, what's so important about this technology and the tremendous concentration of neuroscience and engineering expertise around it, I think about how do we make the most of each interaction we have with the living human brain. And short of opening the head and putting on temporospatial grids with high resolution, the MEG is the best tool we have to understand the living brain. And that is a unique opportunity that I think that this institution is positioned to really advance across many different disciplines. I can tell you personally that this MEG has actually helped me keep patients safer. Roland has always, in his time in neuroradiology, been very gracious about putting together these beautiful integrated PowerPoints that actually show me and my patients precisely where different areas of eloquence were. And that allowed me to have very informed discussions with individual patients, not based on generalized structural atlases, but based on their particular stimulation profiles of this is the risk of a transcortical approach to this lesion. And so you can't imagine the relief that that's brought to individual patients. But more importantly, how it stimulated my own thinking and the thinking of other researchers in our department of how we can actually better define structural targets in conditions that currently aren't managed by neurosurgeons. And so if you asked me what the next decade would look like, dealing with things all the way from post-concussive disorders to neurodegenerative disease to neurodevelopmental diseases, I think that we are going to be entering a place where that gap between the subjective experience of the mind and the structural function of the brain is going to become closer together. And there's going to be new opportunities to modulate that activity using biologic payloads, using the delivery of electrical energy, and using a whole host of other non-invasive energies like focus ultrasound or TMS. And so I know my successor in speaking is Dr. Daskalakis, our chair of psychiatry. He's an international expert in interventional psychiatry and TMS. And so it's not an accident that the talent that's been concentrated on this campus is precisely because of the unique opportunities that are brought by facilities like the MEG. So really excited to be here and for the thought leadership that has brought this, or kept this, I should say, at our campus, and really excited to see what the next decade will bring. So thanks very much for including me in the program.